Okay, good morning, everybody. I'd like to welcome everyone to this launch of the HBSC Trends Report, Trends in Health Behaviours, Health Outcomes and Contextual Factors between 1998 and 2018. So this is a landmark report. HBSC has been going for a long time, and it's a vital part of our data architecture and the way that we find out about how health behaviours in our children are evolving and how we're doing in terms of international comparison as well. So I'd like to take this opportunity to say an enormous thank you to all of the research team, the schools and school communities and parents and teachers that have helped this research and children that have helped this research to happen. So big thank you to everybody. I'm Dr. Fiona Manzer from the Department of Health and from Healthy Ireland, and it's my great pleasure to welcome you all here. So just to run through a few little housekeeping items before we get going. So first of all, the running order is we'll open the webinar with this welcome, and then we'll have a video from the Minister of State for Health and Wellbeing and the National Drugs Strategy, Frank Feehan, TD. Then we'll have a presentation from Dr. Aoife Gavin, who's the lead researcher on this report. And then we'll have a video with some children's perspectives, which are just enormously important for this, followed by a panel and a Q&A session, followed by the thanks and wrap up. So if anyone has questions at any point, we'd like to welcome those, but we'd ask you to put them in the Q&A. And also finally, just to say that the Twitter handle for this is hashtag HBSC Trends with the HBSC T all in capitals. Somebody will put that up on the screen, sorry. And yeah, so I'd first like to introduce now Frank Feehan, TD. His apologies that he's not able to make it here this morning in person, but he's put up a lovely video for us just to introduce and launch this vital report.
Ladies and gentlemen, I am delighted to address you today to launch this study, Trends in Health Behaviours, Health Outcomes and Contextual Factors between 1998 and 2018, the latest report from the Health Behaviours in Schools Aged Children study. First of all, I would like to thank everyone working on the HBSC study, Professor Saoirse McGowan and her team in the Health Promotion Research Centre in NUI Galway, the Healthy Ireland team here in the department, and finally a big thank you to the children and schools who participated in the study, without whom none of this would be possible. HBSC is one of our most comprehensive studies of our young people's health behaviours and an essential tool in monitoring out their health over time. It asked over 15,000 children across schools all over Ireland about their health behaviours. Moreover, the process is coordinated by the World Health Organization and replicated in 47 countries across Europe and the OECD. Ireland has participated since 1998. So not only can we see how we are doing over time, we also have a comparison with other countries and an opportunity to look at international trends in children's health. The health and well-being of our children is a key indicator of the health of the nation, and I am therefore very pleased so many positive trends in this latest study. I am encouraged to see the very significant drop in the number of children who reported being current smokers, from 22.6% in 1998 to 5.3% in 2018. The report also shows that between 2002 and 2018 there was a statistically significant decrease in the proportion of young people aged 15 to 17 who had ever smoked, that reported having smoked their first cigarette at age 13 or younger. These findings are very welcome, especially in the context of Ireland's national tobacco strategy. Tobacco Free Ireland, which seeks to reduce Ireland's national smoking prevalence to less than 5% by the year 2025. This strategy is being pursued with the overall objectives of the denormalisation of tobacco in Irish society and the protection of children from the effects of smoking. This report, along with similar trends seen in the annual Healthy Ireland survey and the ESPAD 2019 report, demonstrates that Ireland is on the right track in reducing the presence of tobacco in daily life. However, further action is still required. This underscores the importance of the Public Health Tobacco and Nicotine Inhaling Products Bill, which is currently being developed. The bill will introduce a licensing system for the retail sale of both tobacco and other nicotine inhaling products, such as e-cigarettes. The bill will also strengthen the protection of children by prohibiting the sale of tobacco products at locations and events intended for children, as well as prohibiting the sale of tobacco products from self-service vending machines and temporary or mobile units in order to further reduce their availability and visibility. I am committed to overseeing the introduction of this very important legislation. With regard to alcohol use, the report finds that from 1998 to 2018, there has been a significant reduction in the number of 10 to 17-year-olds that have ever drunk. In addition, for the period 2002 to 2018, there has also been a reduction in the number of 15 to 17-year-olds reporting having had their first drink at age 13 or younger. These findings are very welcome news, and they are in line with similar results from the European Schools Projects for Alcohol and Other Drugs, or ESPAD, Ireland's report 2019 over the same period, which was pleased to launch in November of last year. We are making progress, but from a public health perspective, I am determined to continue to reduce our young people's exposure to alcohol products. Alcohol has a stronger impact on younger people as opposed to adults who consume the same amount, and particularly in light of its impact on the development of the adolescent brain. In recent months, we have separated and reduced the visibility of alcohol products in our shops and banned price promotions. I look forward to further implementation of the Public Health Alcohol Act to continue the progress we've made. The development of healthy and respectful relationships and sexuality are important areas of development for our children as they enter our teenage years. The study asked questions about sexual activity to those respondents aged 15 to 17. Sexual activity has dropped since 2010, however, so too has condom use amongst those who reported having sexual intercourse. It is difficult to draw firm conclusions from this, however, as the use of many other new forms of contraception have not been queried. Education and information is of vital importance here, and my department is working closely with our colleagues in the HSC and in the Department of Education and Skills to ensure that our children receive the best guidance possible in this area. I would also like to mention two websites managed by the HSC, www.sexualwellbeing.ie and www.beforeyoudecide.ie, both of which are very helpful for children, young adults and parents when considering sexual health. I am encouraged that there has been an increase in the number of children who reported liking school and also in the number who get involved in organising school events. The data showing a decrease in the number of children bullying others is to be welcomed also. However, it is a concern that there has been a significant decrease in the number of children feeling happy about their life and a decrease in the numbers reporting high life satisfaction. Positive mental health is essential for our well-being, and I would urge all young people who may be struggling in this difficult time to make use of the many online resources such as yourmentalhealth.ie website, an information line, and the jigsaw.ie and spunout.ie websites. In summary, it is wonderful to see so many positive trends. Conversely, it is also important to have the data on areas of concern, such that we can consider how best to managing the challenges facing today's youth. I therefore like to restate our public support for this ongoing study, which is a vital part of our data architecture and helps us to fulfil both national and international reporting requirements, as well as its core function of monitoring the health and well-being of our children. I'm sure everyone tuning in today finds this study very valuable in terms of their ongoing work. So many thanks again to all of you that are engaged in this vital work. And I look forward to the next series of updates from the Health Behaviour in School Aged Children study. Thank you very much.
Well, thank you very much, Minister Feehan, for that very useful talk that outlined many of the important elements of this report. But in order to give us some more detail, I'd now like to introduce Dr. Aoife Gavin, who is the senior researcher with the HBSC Ireland team in Galway and is the lead author on this particular trends report. Aoife joined HBSC as a student on placement in 2005 and has been working as a researcher since 2006. Aoife has responsibility for survey and data management within HBSC Ireland and is particularly interested in trends in children's health. And just finally, before I sign out, just to remind everyone that if you have any questions, please put them in the Q&A. Thanks. Over to you, Aoife.
Thank you, Fiona, and thank you for your lovely comments, and also thank you to Minister Feehan for his comments in the previous video. So on behalf of the HBSC Ireland team, I'm delighted to welcome all of you to today's webinar. We would of course love to have met you all today in person, but it is great and we are delighted to see such a high level of interest across quite a varied areas of people interested in today's webinar. So I'm delighted to be able to bring you the results of our latest report. So I have the privilege of doing the presentation, but there are a number of authors, so Dr. Andras Kolto, Dr. Colette Kelly, Professor Michal-Munko, and Professor Serge Nguyen, who will all be joining me at the end of the presentation for a Q&A. So as Dr. Fiona Manstra stated in her introduction, we are using the Twitter handle hashtag HBSC Trends, and we'd appreciate all comments, likes, retweets, etc. on social media. And in terms of on Twitter, if you'd like to follow us at HBSC Ireland as well as at NUI Galway Med, that's where sort of the official tweets in relation to today's launch will be coming from. So we appreciate everybody's support there. Okay, so my presentation this morning is broken into 4 sections. I'll start by giving a brief background to the HBSC study. Then I'll just speak briefly about the methods of the study, and in particular the methods related to today's report. Of course, to speak about some of the key findings from the report, and then to finish off with a little bit about dissemination. So many of you today will be familiar with the HBSC study, but for those who are not, and maybe as a refresher, the Health Behaviour in School-Aged Children study, or HBSC, is a cross-national research study which is run in collaboration with the WHO Regional Office for Europe. So Ireland joined the International HBSC Network in 1994, and data is collected every 4 years. So Ireland has collected data over 6 survey cycles. So in 1998, 2002, 6, 10, 14, and 2018. So in 2018, there was 47 countries and regions across Europe and internationally that collected data, and it's anticipated that there will be 50 countries collecting data in 2022. So this is the 3rd time that the HBSC Ireland team has produced a trends report, and I'm very much looking forward to bringing you through it this morning. In terms of the overall aim of the HBSC study, we like to use this conceptual framework to explain what our study does. So the overall aim of the study is to gain insight into and increase our understanding of young people's health and well-being, their health behaviours, and their social contexts. In general, we aim to collect good, rich data about children's lives in order to improve them. The data is collected in a classroom setting using self-completion questionnaires, and the questionnaires then contain questions around multiple domains of children's lives. that follow the conceptual model here. So we have questions around the social context of children's lives, so their family relationships, their school, their peers, the local area in which they live. We also ask questions about their health behaviours, so both health risk behaviours and health enhancing or health promoting behaviours, as well as many questions on health outcomes. So the HBSC study has multiple objectives that are all central to the work that we do. The launch of today's report particularly focuses on the objective stating to monitor the health of school-aged children over time. So that's one of our key objectives. And the report today obviously speaks particularly to this objective, but also contributes to many more of those listed here. So this slide provides an overview of all of the data that we have collected since 1998. In the 6 survey cycles, we have collected, there has been over 75,000 young people in Ireland who have participated in our study. So you can see we're particularly focused on collecting data from 10-year-olds to 17-year-olds. So we collect data in both primary and post-primary schools. 5th class, 6th class, up to 5th year in the post-primary. You can see in 2006, we began collecting data from the middle childhood children, so the 3rd and 4th class, or the 9-year-olds. But the report today specifically focuses on the 5th class to 5th year, or the 10 to 17-year-olds. This is an important point or part of the presentation to point out that the study itself is cross-sectional in design. So what that means is that we haven't followed the same children from 1998 to 2018, but a cross-sectional study provides a really good snapshot of children's lives at each of these particular time periods. As well, in order for an item or an indicator to be included within the trends report, it means that the question was asked in at least 3 survey cycles. So the same question using the same response options, ensuring comparable data over time. Okay, so now the interesting part, the findings. So before I take you through the findings, I'll just briefly explain what's included in the report or the method behind the report. So the report includes 31 indicators across multiple areas of children's lives. We present an overall percentage for each indicator, as well as a percentage by gender and age group, as well as gender and social class. We also perform statistical analyses to test for the significance of the trend, and this allows us to be confident in the reliability of that trend. You will note in the report we only comment on trends that are statistically significant, but we also comment on the size of the change. So a trend could be significant, but it could be small, or it could be a significant trend and it could be large. So you'll see there's arrows used throughout the report to indicate the size of the change. As well, I mentioned that this is an international study. So of course, we're particularly interested in the outcomes of children in Ireland, but it's nice to also compare Irish children to their international peers. So there's 26 countries who have collected data through the HBSC network at the same time points that Ireland has. So countries are constantly joining the studies, but there's 26 countries who have collected since 1998. And so for that purpose, we provide international comparisons across those 26 countries just to ensure comparability of data over the 6 survey rounds. So what I have here is a screenshot from the presentation, or from the report. So the report is now available online, and I believe you would have gotten a link to the report. So each indicator in the report follows this same pattern. In the top box here, so we'll always provide a definition of the indicator, as well as the cutoff that is used to describe it. So in this particular example, it's looking at the current smoker. So children were asked how often they smoke at present. The response options ranging from I do not smoke to every day, and in this report, current smokers are defined as smoking monthly or more frequently. So for each indicator in the report, it will clearly state what the cutoff is and what the question or the definition for the indicator is. Just below that then, in the findings box, that's where we comment on the overall changes. So the changes between 1998 and 2018, if there's an overall trend, as well as trends in gender, age, and social class. So you can see here in this particular example, there's been a significantly large decrease in the percentage of girls and boys who report current smoking, and that this is evident across all age and social class groups. Just below that then is where we provide the international rankings. And just to note, the percentage for Ireland is only pertaining to the 15-year-olds. So the percentages here may not particularly match with the 15 to 17-year-old percentages in the table, because it's the 15-year-olds only, and that's due to the way that data is collected internationally. So you'll see the Ireland percentage, the HBSC average, as well as our ranking. The graph then provides the overall percentages, as well as the overall percentages for girls and boys over the time. And then finally, the graph is where a lot of the detail is. So you can see we break down the data into 3 age groups, 10 to 11, 12 to 14, and 15 to 17, as well as the 3 social classes. And like I mentioned in the last slide about the arrows, so this column here, the trend, is where you'll see the arrows. So obviously the direction of the arrow is related to the direction of the trend. So in this instance, a decrease. And the more arrows there are, the larger the decrease is. So this pattern is replicated across each of the indicators in the report. So I hope that that will help in reading the report. Okay, so now the findings. So the report itself is broken into 3 sections. So the first section looks at the health behaviours, and you can see here on the screen there's lots of indicators included in this section. The ones in red are the ones that I'll speak to in the presentation, but they're all available to you in the report. So, as has been previously mentioned, Minister Feehan alluded to this in his message, we've seen a significant decrease across all substance use. So a smaller proportion of children report drinking alcohol, smoking cigarettes, and using cannabis. So, and that's across all age, gender, social class groups, which is a very welcome finding. I'd like to particularly focus on this indicator, which is age of first cigarette. So this data is of children who reported that they have ever smoked. How old were they when they had their first cigarette? So in particular, if you look at the light, the peachy color bar, so these are young people who said they had their first cigarette at 11 or younger. So you can see in 2002, it was 26.7, and in 2018, it was 6.3. So we know that early initiation is linked to various other risk behaviours, and we know that the earlier risk behaviour begins, the harder it is to quit. So of course, we would like to see no young people smoking. However, it is encouraging to see this positive trend in delayed initiation, because we know delayed initiation is a positive trend. And just to say that this same pattern is also evident in the age of first drink. Okay, so the next indicator I wanted to highlight was around bullying others. So the reason I chose this one, so there has been an overall decrease in reported bullying behaviours. So this is 10 to 17-year-olds who report bullying others once or more in the past couple of months. So there has been a significant decrease between 1998 and 2018. And while that's positive and very much welcomed, I think it's important to note that between 2014 and 2018, that trend is stable. And so while we welcome the decrease in bullying others, obviously we need to continue monitoring this behaviour to ensure that this decrease continues and is sustained. The next one then is trying to lose weight. So this is young people reporting that they are on a diet or doing something else to lose weight. So again, there's an overall increase in this reported behavior. I think of particular interest here is the increase among boys. And this increase is evident across all age groups, but particularly among the older boys. So it's not necessarily shown as clearly in this graph, but in the table in the report, you'll see quite clearly the older boys, 15 to 17, there's a substantial increase. So I guess the dieting behavior or the trying to lose weight is obviously not just an issue associated with girls. This is in line with other data that we've seen published, and I think it's really important to have this data about boys and their dieting behaviors. So this is toothbrushing. So this is 10 to 17-year-olds reporting that they brush their teeth more than once a day. So the reason I actually included this is because I have an 11-year-old boy, Sean, and when I showed him the report, this is the thing that stood out to him. He couldn't believe that only 70% are brushing their teeth. So we have a significantly large increase in young people reporting that they brush their teeth once or more, which we obviously welcome. But again, just to point out, not to blind us to the work that continues to be done or needs to be done to ensure that this positive trend is sustained over time. So the next indicator then is the vigorous exercise. So this is the percentage of 10 to 17-year-olds who report participating in vigorous exercise 4 or more times per week. And in this instance, the trend remains stubbornly stable over time. So there's inconsistent trends actually within this vigorous exercise. So if we look at the age breakdowns, we're actually seeing an increase in younger girls. In the 10 to 11-year-olds, there's a positive trend, an increase in vigorous exercise. But among the girls aged 15 to 17, there is still quite a decrease quite a low percentage of girls aged 15 to 17 who report engaging in vigorous exercise. This isn't a new finding, but I think it is important to highlight it and to find a way to strive to continue to improve young people's engagement in physical activity. So the next two slides are new for this trends report. So for the first time, HBSC Ireland are able to provide trends data on sexual health behaviours. These questions are only asked of the 15 to 17-year-olds in our study. And essentially, this question is reported ever having had sex, and we report a small decrease in the percentage of 15 to 17-year-olds reporting that they've ever had sex, and that this decrease is more evident among girls than it is among boys. And also condom use. So of those who've had sex, this is the percentage who report that they used a condom at last sexual intercourse. And again, a small decrease in the percentage of 15 to 17-year-olds who reported condom use at last sexual intercourse, and across both genders. So the next section of the report looks at health outcomes. And again, there are many indicators here, and I'll focus on the two: feeling low and happy with life at present. Okay, so for feeling low, children were asked how often they experienced feeling low in the last 6 months. And the response options for this question range from rarely or never to about every day. So the findings here are the percentage of 10 to 17-year-olds who reported feeling low about every week or more frequently over the last 6 months. So I guess the trend here is an overall increase in young people reporting feeling low, and this is evident across both genders, particularly across older children and children in lower social class groups. So this is obviously a concerning trend that needs further investigation. The next one now is happy with life. So this is asking young people how they feel about their lives, and this is reporting feeling happy about their lives at present. So there is a small decrease in the percentage of young people reporting feeling happy with their life. However, I think it is worth noting that the majority of young people in the study report being happy with their life. And the trend here is actually, there's some inconsistent trends within the age and social class. So younger children and children in higher social classes, we've seen an increase in those reporting happy with life, and those older children and lower social classes are reporting a decrease. So the final section of the report looks at the social context of children's lives, and the 4 contexts included are the family, school, peers, and their local area. And so I'll just talk to one indicator from each of the contexts because I am conscious of time. So the first one is the communication with father. And I personally think that this is such a good news story to see such a positive trend in the large increase in the percentage of 10 to 17-year-olds who report finding it easy to talk to their father about things that really bother them. And this trend is similar for the communication with mother, but it's more pronounced in the communication with father. I think there's an interesting, in terms of our international ranking, in 1998, for both communication with mother and father, we would have ranked right at the bottom of the 26 countries, and now in 2018, for both mother and father, we were in the top 10. So this is a positive trend that we should definitely celebrate. I think as well it's interesting to note that the biggest increases in this indicator is girls finding it easy to talk to their father and boys finding it easy to talk to their mother. The next one then is pressured by schoolwork. So this is the percentage of 10 to 17-year-olds who report feeling pressured by school. There is an increase overall across all age, gender, and social class groups. And the older children, the 15 to 17-year-olds, are much more likely to report higher levels of feeling pressured by school. But the increase over time is evident across all age, gender, and social class groups. So in terms of close friends of the same sex, we know peer relationships are really important and play a vital role in young people's health and well-being. And so the vast majority of Irish children across the 3 indicators about peers report positive peer relationships. So that's good to see. And finally, the good places to spend free time. So this is the percentage of 10 to 17-year-olds who reported there are good places in the local area to spend their free time. And what we have here is a positive trend, a significant increase across all age, gender, and social classes reporting that there are good places in their local area to spend their free time. So that was just a very quick whirlwind tour of the report, and there's much more information included, and I do welcome and encourage you all to look at the report. But I guess just in summary, the report itself presents some good news and then I guess some not so good news. So the good news, of course, the decrease across all risk behaviours, the positive increase in parental communication, as well as the increase in young people reporting good places to spend free time. However, we're also seeing the increase in school pressure and the increase in feeling low. Alongside that, really, I guess, not enough improvement in the diet and physical activity indicators as well. But I think what's really important is that we have this data and that we can use this data to examine the trends and monitor health behaviours over time. So one of the exciting things that will be coming shortly from the HBSC team is our data visuals. So this data that I presented today, as well as data on other indicators, will be available on our website in an interactive way. So you can look at comparisons over time across age, gender, and social class for various indicators. And so we'll let you all know when that's available through social media and through our mailing list, but we're very much looking forward to sharing this data because obviously we feel it's very important to not only collect good data, but to disseminate that data in a way that is useful to improving the lives of children in Ireland. And I guess just to note the vast amount of publications or the vast areas of dissemination that the HBSC Ireland data has been used. Not just from the HBSC Ireland team, but also by probably lots of you who are joining us today on the webinar. And we're very eager and willing to share this data. And we look forward to sharing the trends data as well when it's ready. So just to finish off, I mean, this report is, as I'm the lead author on the report, but I mean, obviously it represents a culmination of work since 1998. I think Saoirse and I were speaking earlier, and I think there's been over 100 different researchers and staff who've worked on the HBSC studies. So I have the privilege of doing the presentation today, but of course I'd like to acknowledge everybody's work that has gone into making today's report possible. And I think primarily as the HBSC Ireland team, we'd like to thank the schools and principals, but also the children who, as I mentioned, over 75,000 children since 1998 who have participated in the study. So we've actually asked a number of young people for their views on the report and on the report. And so we have a short video that we would like to share with you all, which incorporates young people's views. So thank you very much.
This fact stood out to me because I would have thought the percentage would have been higher now, as lots of more young people drink for fun or believe that drinking can help solve their problems. But then when I thought about it, there is a lot more health and safety knowledge about alcohol now.
People are more aware of the effects that cigarettes and stuff have on their body.
I think young people need to learn and realise that everything on social media is just a highlight of people's lives, and it's not what the real world is like.
I think spending more time with the people you enjoy spending time with, like your family or your friends, because they'll help you feel good about yourself and have a better mood overall.
More children are pressured by schoolwork now than they were in 1998 by 11.4%.
There's a big emphasis on more the test result and how you do in the exams than actually learning.
I usually get my sports coaches, and they give us like PowerPoints sometimes on what to eat and what's good for you, and they tell you like nutrition to use and eat.
I think we all need to think about keeping our planet safe and healthy for the future and to live more sustainable lives so the planet is healthy.
Well, thank you all very much. Chloe, Sean, Zenon, Liam, Tom, Gabrielle, Ashlyn, Isabel, Evine and Joshua for your contributions there. Really great to hear, first of all from Aoife on the wonderful findings of this report and how interesting it all is. I'm sure that everyone here who's in a position like mine, working for a government department, agency, NGO, community group, generally part of the health promotion and public health communities, and also those who are part of school communities, children, teachers, parents, and also the members of the international HBSC community will be fascinated to have heard those findings and also to have heard that wonderful resume from the children as to what they thought about it all. It's really great to hear the children's voice.